Even though ginger is one of the most widely used and familiar botanicals, it is important to begin with precautions when discussing concentrated ginger extract. While generally well tolerated, high-dose supplements can sometimes cause mild gastrointestinal discomfort, heartburn, or temporary changes in blood clotting. People taking anticoagulants, antiplatelet drugs, or medications for diabetes or blood pressure should consult a healthcare professional before starting supplementation. Ensuring that the extract is standardized and free from fillers or contaminants is also crucial, as potency and purity can vary significantly between products. Once these sensible precautions are understood, the health-promoting potential of ginger extract, particularly for individuals with metabolic syndrome, becomes both measurable and compelling. The study in question followed adults diagnosed with metabolic syndrome and measured several key indicators of systemic health, including high-sensitivity C-reactive protein, hsCRP, and insulin sensitivity, comparing the effects of ginger extract to a placebo over time. hsCRP is one of the most reliable markers of low-grade, chronic inflammation and is closely associated with cardiovascular risk, insulin resistance, and progression toward type 2 diabetes. Elevated hsCRP reflects an internal environment where blood vessels, tissues, and organs are under constant inflammatory stress, contributing to long-term metabolic and cardiovascular deterioration. The reduction in hsCRP seen with ginger extract supplementation indicates that this botanical actively calms systemic inflammation, lowering the silent stressors that often accelerate disease in metabolic syndrome. Equally important, the study demonstrated improvements in insulin sensitivity. Insulin resistance is a central feature of metabolic syndrome and a major driver of type 2 diabetes, obesity-related inflammation, and vascular complications. By enhancing the body's responsiveness to insulin, ginger extract not only helps stabilize blood sugar, but also reduces the metabolic stress that contributes to further inflammation, oxidative damage, and tissue dysfunction. When insulin sensitivity improves, glucose is more efficiently transported into cells, energy metabolism stabilizes, and the body's inflammatory response is naturally dampened, creating a self-reinforcing cycle of health improvement. What makes these findings particularly encouraging is the dual-action profile of ginger extract. Unlike many interventions that focus on either inflammation or metabolic regulation alone, ginger appears to positively influence both simultaneously. The anti-inflammatory effects, reflected in lowered hsCRP, help protect blood vessels, the liver, and adipose tissue from chronic stress. Meanwhile, improved insulin sensitivity supports metabolic balance, enhances energy utilization, and reduces fat accumulation in tissues prone to inflammation. This integrated effect is particularly valuable for adults with metabolic syndrome, where multiple systems are dysregulated and small changes can have cascading benefits across cardiovascular, metabolic, and inflammatory pathways. Mechanistically, ginger's polyphenolic compounds and bioactive gingerols appear to mediate these effects through several pathways. They can inhibit pro-inflammatory signaling cascades, modulate cytokine production, and enhance cellular antioxidant defenses, while simultaneously supporting glucose uptake and insulin receptor function. This multi-targeted action creates a more resilient metabolic and vascular environment, allowing the body to recover from daily oxidative and inflammatory stressors more effectively. For adults with metabolic syndrome, this means arteries are less stressed, blood sugar levels are more stable, and tissues experience less chronic inflammatory damage, all factors that directly contribute to healthier aging and reduced cardiovascular risk. Another positive aspect is practicality. Standardized ginger extract capsules provide a consistent, effective dose without requiring large volumes of raw ginger, which can be difficult for some adults to tolerate or incorporate regularly into the diet. This accessibility makes it easier to sustain supplementation over months, which is critical because the anti-inflammatory and metabolic benefits of ginger are cumulative and best realized with consistent long-term use. The broader implications of these findings are significant. Reducing hsCRP and improving insulin sensitivity simultaneously supports cardiovascular health, metabolic stability, and even cognitive resilience, as chronic inflammation and insulin resistance are both linked to accelerated cognitive decline. Over time, ginger supplementation can help create an internal environment in which energy metabolism is more efficient, blood vessels remain flexible, and chronic inflammatory stress is reduced, contributing to better overall vitality and reduced risk of long-term complications. Taken together, the evidence suggests that ginger extract is a highly promising, natural ally for adults with metabolic syndrome. By lowering systemic inflammation, improving insulin sensitivity, and supporting metabolic resilience, it addresses two of the most critical pathways driving disease progression in this population. When used responsibly and consistently, ginger extract provides a practical, evidence-based strategy to enhance cardiovascular and metabolic health, reduce inflammatory burden, and promote long-term vitality, making it more than just a supplement, a proactive tool for healthier aging and improved quality of life.